Public health experts are sounding the alarm over the U.S. withdrawal from the World Health Organization. U.S. President Donald Trump formally requested to withdraw funding from the WHO on his first day back in office. It's his second attempt to break ties with the UN agency. One of Trump's arguments is over the size of America's financial contributions. In 2023, U.S. donations made up nearly 18% of the WHO's $6 billion budget. Experts say a full withdrawal would have dire consequences and undermine the country's position as a global health leader. For a closer look this morning, we're joined by Paul Spiegel. He's director for the Center for Humanitarian Health at Johns Hopkins Bloomberg School of Public Health. And he's joining us from Baltimore. Good morning to you.
Good morning, Anne-Marie.
Set up for us, how will the loss of U.S. contributions affect the WHO's ability to respond to global emergencies like another pandemic or some issues that we're facing right now?
It'll clearly have a devastating effect. As you mentioned, it's the largest contributor to WHO, and it's extremely unlikely that other countries are going to be. Early warning, disease surveillance is going to have a negative effect in terms of emergency responses to Sudan, to all the humanitarian emergencies that we're aware of.
The U.S. is seeing, just as a case study, as a small example, the U.S. is seeing a rise of avian flu, and at least 66 human cases have been reported. So if we take the WHO out of this equation now, how will that affect America's ability to respond to diseases like this in the future? Because I think what people don't realize is there's a sharing of information back and forth between America and this agency.
Exactly. I mean, the Centers for Disease Control has early warning systems in many countries, and they can use a lot of technology. But WHO is often embedded in the ministries of health. They're working together with ministries of agriculture to look at zoonoses, which is diseases amongst animals, as well as early warning for diseases, particularly diseases of epidemic potential amongst humans. And so this lack of sharing of information will clearly make not only the world less safe, but it'll make Americans less safe.
We currently have more than 100 armed conflicts going on around the world, and those armed conflicts leave people on the ground with dire health emergencies, crises, as we see in other countries. So without this American funding, what will that mean for humanitarian aid and organizations on the ground who are right now in the midst of dealing with these crises?
So I think we have to divide this into what the U.S. government provides to WHO, but also for humanitarian emergencies, which is the area where I work. Most of the money is not coming through the U.S. to WHO, to UN or NGOs, but rather bilaterally. And so it's going to, with this foreign assistance freeze of at least 90 days, and then a re-examination of foreign assistance and what is in America's best interest. Already we're seeing devastating effects. There have been stop orders from within my university and other universities, but much more important for NGOs and UN agencies. So emergency humanitarian need currently has stopped in most places, and it's likely going to continue. So together with the withdrawal of WHO and that lack of funding, together with this 90-day freeze and then likely major changes in humanitarian funding, it is very, very bleak.
When it comes to funding, and you brought up American interest, and I'm glad that you did. Member fees are typically set by a country's GDP and population size. And one of the reasons President Trump gave on the day he signed the order is because of contribution sizes. So for the 2022-2023 biennium, the U.S. donated $1.2 billion. China, by comparison, and President Trump brought up this comparison, whose population is 4 times the size of the U.S., donated $157 million for the same time period. Does he have a point here?
No, because I think we're conflating two things. One is the assessed contributions that countries have to give, and then the voluntary contributions. So during that time frame, the assessed contributions of the U.S., what they actually were asked to provide was 122 million out of the 1.2 billion. So actually 1.1 billion that the U.S. is providing to WHO are actually voluntary contributions, and they are the core. I mean, so we have to differentiate between what is being requested according to GDP and population size.
It is a fascinating story, and one I know that we're going to continue to see the effects of, so we will speak with you again. Paul Spiegel, Director for the Center for Humanitarian Health at Johns Hopkins Bloomberg School of Public Health. Good to have you with us this morning. Thank you.
Thank you, Anne-Marie.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.